Good morning. This is All India Radio Kohima. The morning news are read by Jonas Yantan. Prime Minister Narendra Modi arrived in New Delhi after a fruitful visit to Japan. In a tweet, Modi said during the fruitful visit, he attended various bilateral and multilateral programs. He expressed happiness that Quad has emerged as a vibrant forum to further global good. Modi said he also had excellent bilateral meetings with all the Quad leaders. The Prime Minister said he had excellent discussions with the business leaders of Japan and an engaging interaction with the vibrant Indian community in Japan. Modi thanked the government and the people of Japan for the warm hospitality. National Health Authority has launched a revamped Ayushman Bharat Health Account (ABHA) mobile application to manage health records under Ayushman Bharat Digital Mission. Union Health Ministry said the ABHA app, previously known as NDHM Health Records app, is available for download from the Google Play Store and already has over 4 lakh downloads. The updated version of ABHA app has a new user interface and added functionalities that enable individuals to access their health records anytime and anywhere. The existing ABHA app users can also update the previous app versions to the latest one. The Department of Consumer Affairs has cautioned restaurants on forced charging of service charges on consumers. In a letter written by Secretary, Department of Consumer Affairs Rohit Kumar Singh to President of National Restaurant Association of India, it has been pointed out that restaurants and eateries are collecting service charges from consumers by default, even though the collection of any such charge is voluntary. The department has called a meeting on 2nd of next month with the National Restaurant Association of India to discuss the issues pertaining to service charges levied by restaurants. Nagaland Pradesh Congress Committee (NPCC) has alleged the Chief Minister and the United Democratic Alliance (UDA) is not ready for a solution yet. In a release, NPCC President K. Terry also accused the Chief Minister and UDA government have never told the Union government to go ahead with settlement. He has said that if any settlement comes about, it was because of the pressure of the people and the Congress. Terry said the Congress party had made its stand very clear to the then interlocutor R.N. Ravi and the Government of India. NPCC President also maintained that state government is clear that the people of Nagaland want to implement the agreed position of the Working Committee of NNPGs. They also know the framework agreement has ruled out sovereignty and integration, and therefore talks for Nagaland have concluded, he added. Terry further observed that CM Rio lacks in courage and wisdom to bring settlement despite being elected leader of the House and Chief Minister for almost 20 years. He said a CM cannot reason with GOI or NSCNIM leaders to solve the problem. Terry alleged that Rio is certainly under pressure while BJP is doing everything to humiliate him, adding that Rio will do everything possible to save his alliance with the BJP. Nagaland yesterday reported one new infection of COVID-19 from Dimapur, taking the total confirmed cases to 35,496. Nagaland has now one active case after remaining a coronavirus-free state since May 18th. With no recoveries or deaths reported, the state has a total number of 33,245 recovered cases and 757 deaths due to the infection. Rashtriya Bal Swasthya Karyagram Kohima, Mobile Medical Unit Kohima, and Urban Primary Health Center UPHC Portolan conducted a free medical health camp come celebration of Menstrual Hygiene Day at Azeton School yesterday. A total of 170 beneficiaries, including the children and staff, were benefited from the medical camp. During the camp, free screenings, lab tests, blood pressure were carried out, while free medicines and referral cards were also distributed to the children. Besides individual counseling, group counseling and awareness program on Know About Menstruation were imparted to the girls commemorating Menstrual Hygiene Day, which falls on May 28. The aim for conducting the medical camp is to bring awareness and help children access to basic healthcare services or knowledge about the disease. That is all we have in this morning news bulletin. Have a good day.